Bir Hospital is it's a tertiary hospital of Nepal. It's the biggest hospital of Nepal and oldest hospital of Nepal. It's about 122 years old hospital, and we have different departments in this hospital, including emergency and accident, medicines. Under medicines, there are other super specialized departments like gastromedicine, cardiac medicines, neuromedicines. Similarly, we have surgery department. Again, there is a super specialized department like gastrosurgery, cardiac surgery, and we've got orthopedics department, and then we have pathology department. So we have so many departments. ENT. There are so many departments. So this is the biggest hospital, and this hospital we get lot of referrals from different part of Nepal. Regarding patients, those who come to Bir hospitals, we see a lot of patients of let's say road traffic accidents. Because if there a road traffic accident happens, or natural disasters happens, or anything happens, they are directly, if possible, brought to this hospital, because you get a lot of manpowers and lot of equipments, well-trained doctors, so that they directly have a less. They can buy a lot of time, and they don't have to waste a lot of time investigations are doing and being referred here. So we get a lot of patients, such kinds of patients. That is number one. Number two, those patients are a majority those which are not diagnosed in community level, in the village level, in the district level, because the doctors actually see those patients, and if they are not able to diagnose them, if the diagnosis is dilemma, and treatment, if the opportunity of treatment is quite less there, then they are referred to this hospital so that they can be treated well, they can be diagnosed properly. So those kind of patients we get a lot. Besides this, there are a lot of complicated surgeries which can be done here, because in the rural part of in our country there is no operation theaters, and there are so many surgeries which cannot be done in even zonal level, and we have so many kind of equipments in this hospital. So those patients which are complicated are also transferred here. So the patients basically, if we see the socio-economic status, poor people generally visit this hospital because this is a government hospital and the charges are very less. And if the patients are well-to-do, they can even visit private hospital because the rush is less. They can see direct, they can reach to doctor very easily. But the number of patients is quite large, the volume is quite large. So the charges are quite less, so I can see that a lot of poor people and low socio-economic people also come to this hospital beside those complicated cases. Yeah, well, talking about manpower personals, it's like we have a chain of peoples working. There are a lot of there are guards, there are sweepers, and besides we're talking about medical personals, there are nurses, which are of staff nurses, and then like there is a supervisor, then there is a matron. So that is one department of nursing department. Besides that, regarding doctors, there is a layer of interns doctor who do their medical graduation from different parts of the world, let's say China, and they come back to their country, Nepal, and do their internship. So we have 60 interns at a time. They do 6 months internship, and then like 60 other interns again join after they finish. So 60 at a time interns are working in this hospital. And then the second layer is medical officer who have already finished the internship. And we get 2 to 3 medical officer in each unit of the department. Let's say in medicines, let's say there are 4 units, then 1 medical officer is working for each unit. So that's the second layer. And the third layer is the registrar. The third layer is the medical students who are doing MD, post graduation. First year is the first layer, second year is the second layer, and final year is the final year. And then above the final year MD students, postgraduate and PG students, there is a registrar who have already finished their post graduation, and then above them there are assistant professor, associate professor, and then professor in each department. That's how is the system of this hospital. Yeah, I'd like to say that Nepal is not a rich country. It's not a developed country. It's a developing country. Let's say it's an underdeveloped or developing country. So we don't have as much as doctor as other countries have, as much as nurses other countries have. So although now a lot of people are doing their medical graduations, and there were no much hospital. This is the oldest hospital. This was only one hospital in entire Nepal. Now a lot of hospitals are coming up, but still the number is quite less of the doctors, nurses, and hospital in comparison to the patient-doctor ratio. And even the equipments, because we are not that rich, so we are working with less equipments, less medical personals, less trained nurses, less hospitals. So even then we are trying our level best, and we would be more than happy if we get an opportunity to train our people as a doctors, as a nurses, and we can, if we can make a lot of other hospitals in the community level, in the rural area, and send other trained powers, then I think the health part of this country would come up more. But still, with less power, with less equipments, with less manpower, we are doing what we can, and I think that's going well for the date. But this is I think this is what we are doing is quite less, and the requirement is quite more. So I think that is the thing which is required in our country: manpower, trained manpower, equipments, and more hospitals.